We've all been there. It's 5:30 on a Friday. You're completely drained from the work week, and you pull out your phone to text a friend. You tell them you need to stay in and protect your peace. You are definitely not alone in this habit. In a recent poll of over 30 million people, nearly 3/4 of respondents admitted they actively cancel plans just so they can sit at home by themselves. This chart shows the long-term trend of human connection, and the drop-off is staggering. Compared to 20 years ago, the time we spend socializing with our friends has dropped by nearly 1,000 hours per year. Researchers who study public health, like Kasley Killum at Harvard's T.H. Chan School, have been looking closely at the medical fallout of all this isolation. The data suggests that this modern push for isolation can be a double-edged sword. While it feels like protection, researchers are investigating whether excessive withdrawal is actually contributing to the very exhaustion we're trying to escape. To understand the physiological impact, scientists placed two groups of people inside functional MRI machines. One group fasted all day with no food, while the other group was completely isolated all day with no social contact. This side-by-side comparison reveals the results. Being starved of human contact lit up the exact same neural regions as being starved of food. Loneliness registers as a biological signal, a neurological indicator that the body lacks a fundamental requirement for physiological stability. When you ignore that signal, your body registers the isolation as a serious stressor. This triggers a surge of cortisol into your system, which then drives up widespread cellular inflammation and suppresses your immune response. Over time, this chronic inflammatory state breaks down your physical health. Extensive studies show that chronic loneliness increases your risk of premature death by up to 53%, putting the mortality risk on par with smoking and obesity. If you are working long hours or dealing with caregiving duties, the idea of getting off the couch and going out can feel physically impossible. You feel too exhausted to talk. But medical researchers propose a biological counterargument to that feeling, known as the stress buffering hypothesis. When we interact with people we care about, our brains release dopamine and oxytocin. These chemicals act as a biological shield, actively quelling the cortisol and buffering those intense stress pathways inside our bodies. Look at this scatterplot from a 2-week study tracking social support. When researchers exposed participants to a cold virus, they found a direct inverse correlation. People with the most social support were significantly less likely to get sick and experienced much milder symptoms. This research suggests that social contact functions less like a chore and more like a physiological buffer. It provides a chemical counterbalance to the high cortisol environment of a stressful week. This diagram visualizes human well-being as a structure typically held up by two main supports, physical health and mental health. But there is a third, equally critical column carrying the load, your social health. This structural model has gained heavy traction at the highest levels of medicine, with groups like the World Health Organization officially elevating social connection to the same level of importance as diet and exercise. You wouldn't skip brushing your teeth for a month just because work was busy, yet we routinely cancel our social interactions and let that third pillar crumble under the guise of being too tired. Social health requires the same deliberate rigor as a gym routine. You have to actively stretch and tone those social muscles. To rebuild that strength, researchers recommend a specific workout routine called the 5-3-1 protocol. The 5-3-1 protocol, 5 stands for distinct weekly interactions needed to build diverse social ties. 3 represents close, supportive relationships you maintain. Finally, aim for 1 cumulative hour of daily connection, built through micro-moments like a quick chat, call, or text. The next time you have 10 spare minutes, resist the convenience of scrolling through your phone in silence. Go for connection first. Because unlike a workout at the gym or a therapy session, strengthening your social health has a unique double impact. A single conversation biologically heals both you and the person you're talking to at